Do you have an itchy and scaly rash that just won't go away? It might be psoriasis. If you've experienced it before, you know how uncomfortable it can be. Psoriasis can be both painful and hard to ignore, and it often doesn't clear up on its own. So, what can you do to improve your condition? Is it possible to prevent psoriasis? Are there specific foods that can provide relief? In today's video, we'll delve into the topic of psoriasis in great detail. We'll cover everything from the psoriasis diet to its triggers and more. Let's start by gaining a deeper understanding of psoriasis. But before we continue, please don't forget to like and subscribe to our channel. What is psoriasis? Psoriasis is a chronic condition often linked to issues within the immune system, leading to the development of scales on the skin and the occurrence of dry, itchy, and sometimes painful patches. This happens because the immune system becomes overactive, causing an abnormal buildup of skin cells. But how does this process occur? Skin cells have a glow rate originating deep within the skin and gradually making their way to the surface before naturally shedding. This entire life cycle for a skin usually takes about a month. However, in individuals with psoriasis, this process is significantly accelerated, lasting only a few days. This rapid turnover doesn't allow sufficient time for old skin cells to slough off before new ones replace them. As a result, there's an accumulation of skin cells, leading to the formation of rough scales. These scales are commonly observed on areas like elbows and knees, but can also manifest on the neck, hands, feet, scalp, and other parts of the body. Research indicates that over 7 million adults in the United States suffer from psoriasis, making it prevalent approximately 3% of the population. People with type 2 diabetes or heart disease are at higher risk of developing psoriasis. Moreover, this skin condition is associated with other health challenges, including irritable bowel disease, anxiety, and depression. There is a notable connection between diet and psoriasis, and some specific dietary approaches have shown promise in alleviating psoriasis symptoms. One such approach is a low-calorie diet. Here's some information on how this diet may be beneficial. A low-calorie diet involves reducing your daily calorie intake, which can lead to weight loss. This approach has shown promise in helping people with psoriasis for several reasons. First, weight reduction. Psoriasis is often associated with obesity or excess weight. Losing weight through a low-calorie diet can reduce inflammation in the body, which may in turn help improve psoriasis symptoms. Second, insulin sensitivity. A low-calorie diet can enhance insulin sensitivity, which is particularly relevant for individuals with psoriasis, as the condition is associated with insulin resistance and an increased risk of type 2 diabetes. Third, reduce inflammation. Obesity is known to promote inflammation throughout the body, and this inflammation can exacerbate psoriasis symptoms. By shedding excess pounds through a low-calorie diet, inflammation levels may decrease. And lastly, enhance immune function. Weight loss in a balanced diet can strengthen the immune system, potentially helping to regulate the immune responses involved in psoriasis. It's important to note that while a low-calorie diet may show a promise, it should be undertaken with caution and under the guidance of a healthcare professional or registered dietitian. Rapid or extreme calorie restriction can have adverse effects on your health, so it's crucial to strike a balance between weight loss and proper nutrition. Additionally, the effectiveness of dietary interventions can vary from person to person. What works for one individual may not work for another, so it's essential to consult with a healthcare provider to determine the most suitable dietary approach for managing your psoriasis symptoms. Other diets such as Mediterranean diet or anti-inflammatory diets have also shown potential benefits for individuals with psoriasis and are worth exploring in consultation with a healthcare professional. Now, let's break down the information about diets and lifestyle factors that can influence psoriasis. Number 1. Gluten-Free Diet. If you have both celiac disease and psoriasis, a gluten-free diet can be beneficial. Research suggests that people with psoriasis may have increased sensitivity to gluten. A study found that a gluten-free diet led to significant improvement in psoriasis symptoms among individuals with gluten sensitivities. Even if you don't have celiac disease, trying a gluten-free diet can provide relief from psoriasis symptoms. This involves avoiding gluten-containing foods like wheat, rye, barley, malt, Brewster's yeast, including most bread, pasta, and cereals. Number 2. Antioxidant-rich diet. Fruits and vegetables are essential for overall health, but they can be especially important for individuals with psoriasis. These foods are rich in vitamins, minerals, fibers, and antioxidants. Antioxidants can combat free radicals, which contributes to chronic inflammation, a trigger for psoriasis. Carrots, tomatoes, fresh fruits, and vegetables high in antioxidants like glutanoid, found in broccoli, garlic, kale, cabbage, and cauliflower, may help reduce psoriasis symptoms. Number 3. Dr. Pagano's diet. Dr. Pagano's dietary approach focuses on consuming a high amount of fruits and vegetables, limiting meats, grains, seafood, and avoiding red meat and processed foods. This approach aims to minimize psoriasis flare-ups and is outlined in his book Healing Psoriasis: The Natural Alternative. Number 3. Fish oil. Fish oil supplements rich in omega-3 fatty acids may improve psoriasis symptoms by reducing inflammation. In a study, participants who received fish oil along with a low-fat diet experienced significant relief from psoriasis symptoms. Omega-3 fatty acids lubricate cells, reducing inflammation. Number 4. Vitamin supplements. A diet rich in vitamins can help manage psoriasis symptoms, but sometimes supplements may be necessary. Consult your doctor before taking any supplements to ensure they are suitable for your condition. Number 5. Foods to avoid. Certain foods can trigger or worsen psoriasis flare-ups. These include alcohol, processed foods high in fat, sugar and salt, and nightshade plants like potatoes, tomatoes, eggplants, and peppers. And lastly, number 6, triggers for psoriasis flare-ups. Several factors can trigger psoriasis flare-ups, and these triggers can vary among individuals. Stress is a common trigger, so stress management is crucial. Injuries, certain medication, and infections can also exacerbate psoriasis symptoms. Remember that psoriasis management is individualized, and what works for one person may not work for another. Consulting with a healthcare professional or dermatologist is essential to develop a personalized treatment and dietary plan for managing psoriasis effectively. Now, how is psoriasis diagnosed? As mentioned earlier, psoriasis primarily stems from genetic factors or an immune system malfunction that mistakenly attacks healthy skin cells. When diagnosing psoriasis, your doctor typically begins with a straightforward physical examination. Psoriasis symptoms are often distinctive, making them relatively easy to differentiate from other conditions that could have similar symptoms. However, if your symptoms are unclear or if there is a doubt about a diagnosis, your doctor may offer biopsy. In this procedure, a small sample of your skin is collected and sent to laboratory for analysis. This helps rule out other potential causes of your symptoms and confirms whether you indeed have psoriasis. Once the biopsy results are available, your doctor will focus the next steps with you. Current treatment approaches for psoriasis focus on managing the symptoms of the condition, as these symptoms tend to appear and disappear over time. Depending on severity of your psoriasis, your doctor may recommend various treatments. First, light therapy or phototherapy may be prescribed to reduce flare-ups. Second, creams and ointments can be used to control the turnover of skin cells and alleviate symptoms. And lastly, in more severe cases of psoriasis, immunosuppressant medications may be considered to manage the condition. The choice of treatment depends on your specific circumstances, and your doctor will work with you to develop personalized treatment plans to effectively manage your psoriasis symptoms and improve your quality of life. In conclusion, psoriasis is a chronic skin condition primarily caused by genetic factors and immune system dysfunction, leading to the immune system mistakenly attacking healthy skin cells. Diagnosis typically begins with a physical examination due to the distinctive nature of psoriasis symptoms. However, when uncertainty exists, a biopsy may be conducted to confirm the diagnosis by ruling out other potential causes. Current treatment strategies for psoriasis are aimed at managing its symptoms, which tend to fluctuate over time. Depending on the severity of the condition, treatment options may include light therapy, topical creams and ointments to control skin turnover, and in severe cases, immunosuppressant medications. Treatment plans are individualized to cater each patient's unique needs, with the goal of effectively managing psoriasis symptoms and enhancing their quality of life. Regular consultation with a healthcare professional or dermatologist is essential for ongoing psoriasis management. And that's it. Thank you for watching this video. Also, don't forget to like and subscribe to our channel.